Now, let's welcome Dr. Lori Tackman of Novant Health Pediatrics, Brunswick. Dr. Tackman, it is so good to see you again.
So good to see you.
Thank you so much for coming. Yeah. And now there may be a few people out there who didn't see you the first time, so let's remind them about your education and your background.
Sure, absolutely. I grew up in Ann Arbor, Michigan, and then I went to medical school at Michigan State University.
Wow.
And then stayed in the Midwest and went to Indiana University and trained at Riley Hospital for Children. And when I finished up there, then moved to North Carolina in 1999.
Wow. Yeah, it sure is hot here now, though, isn't
yes,
it, Lori?
It sure is.
Not like Michigan.
Yep.
So, let's talk a little bit about your clinic. Tell me about your pediatric practice in Supply, right?
Yes, absolutely. We are a general pediatric clinic. We see newborn through college-age children. And we also go to Brunswick Medical Center to see the newborns. We do procedures there, and we also do some procedures in our office.
Great, and it's located right off of 17. It's very convenient to get to.
Yep, right off of
Just
Highway 17.
south of the hospital a little
about
bit.
5 minutes south,
Right. Well, I know that, like me, a lot of grandparents and a lot of parents out there have questions now about their children and the pandemic. And as we get closer to school starting, what tips do you have to keep our children safe?
Yes.
That's a hard one, I know.
Yes, yeah. There's a lot of different variables there. So first of all, keep an open line of communication with your children. Make sure they're not too anxious, and you know, they understand that, you know, it's going to be okay. And there are things that are different now, and we need to follow different rules, but it's all right. And if they have any questions, they need to, you know, talk to their parents and just be consoled if they're starting to get a little anxious, you know, because they've been cooped up for a little bit as well. Also, going back to school, and always practice at home, lots of good hand washing, wear the mask when they need to, when it's appropriate, and try to keep social distance. In school, I think they're trying to keep about 3 to 6 feet in between the children. And if the child is ill, not feeling good, then they need to stay home.
Right.
So, and make sure they follow all the rules that the regulations now that the schools have. And so it's going to be a completely different way of going to school. So, you know, definitely go over with the children the new rules, wearing the mask, lots of good hand washing, try to stay about 3 to 6 feet.
Right, yeah, that's all good advice. During this time, I know the kids have been cooped up and people are starting to talk about play dates, and I'm not so sure how that works. How do you know your playmates are safe? So what tips do you have for parents around play dates?
Well, first of all, with play dates, with your own family, if there's any family members that are in the high-risk category, that if they do get the coronavirus, it could be some real serious complications, I probably would not have any play dates at this time. Just do your best to entertain them at home and just have some fun adventures and activities, you know, within the family. But if everyone's pretty healthy, doesn't have any health concerns, that they can probably have 1 or 2, you know, close friends that parents feel pretty comfortable that that this other family has been a lot of variables that they've, you know, been doing their part and staying at home and not going out and about and not feeling ill. And if you feel comfortable with the other family, then absolutely, I think you can have some play dates. I would keep it small, 1 to 2 children. I would try to have them play outside, do some outside fun adventures, and you know, wear a mask if appropriate. Lots of good hand washing, and
Well, let's talk a little bit about your office. Now, are you conducting wellchild visits in the office?
Yes, we are.
Okay.
Yep, we've continued to see wellchild visits this entire time. Yeah, so in those who have felt uncomfortable with coming in, we've offered video visits as well.
Oh, nice. And so you're still keeping up with the shot
yes. Yes, yep, the vaccines.
Online,
Yep.
I mean, on time and keeping up with the schedule.
Right, that's very important. We're really trying. Of course, we're seeing the newborns in our office and the infants because they get the vaccines more frequently there. And we really don't want them to get behind.
Right.
So we're really trying to stay up to date with everybody. And even the older children, we don't want them to get behind, especially if they're going to be going to school or doing, you know.
Yeah, you don't want to miss those.
Don't want to miss the vaccines. Yeah.
For sure, for sure. If a child is sick right now, should they be concerned that it's coronavirus, or what should they do? Should they call?
Well, if parents have any concerns, absolutely give their pediatrician a call. But the main symptoms that you're looking out for are a fever, cough, shortness of breath, sore throat, vomiting, diarrhea, rash, and kind of bloodshot eyes.
Wow, that's a lot to watch out for.
Yeah.
But any one of those or any two of those, they need to just call and get reassured.
Absolutely.
Great.
Absolutely.
All right. Well, this has been great information, Dr. Tackman. For our viewers at home who are interested in scheduling an appointment with you, you are taking new patients.
We
correct?
are. Yes.
And they can just call your office?
Yes. Yes,
and that phone number is?
910-721-4400.
4400. Great. Well, thank you so much for joining us today. It's been a pleasure to have you.
Yes,
and I hope that we all get through this safely, especially our kids out there.
Me too. Yep, thank you.
Thank you.